Do you already know Vicky Sana?
Welcome, dear viewers, to our experiential medicine format today. Today we're talking about a very special laboratory. The doctors use complementary integrative medicine, especially with cancer patients. Blood can be sent in there with tumor cells that can actually be analyzed. And we can determine which therapy is most successful in treating the tumor. And that is, of course, a breakthrough. And I am very pleased that I have a doctor with me today who is already working with this, which of course also gives many cancer patients self-determination, hope, but also a clear, targeted, individualized therapy. You can look forward to it. Hello, dear Heinz.
Hello, Corina.
I'm glad you're here.
Always a pleasure.
And yes, I was particularly looking forward to the interview, I have to say, because I haven't spoken to anyone about it yet. All I know is that Alexander is super enthusiastic. We have a lot of doctors who also work with this topic. You are too, and it's fascinating. And that's why I'm glad you're here, of course. Can you explain what it's actually about?
Well, it's called R.G.C.C. in English. And it says it's an abbreviation for Research Genetic Cancer Center.
Research Genetic Cancer Center.
It's a laboratory in Greece.
In Griechenland.
The founder is Greek, but lives in Switzerland. That's Dr. Ioannis Papazoteriou, by the way. I know him personally. He has been to Winterthur twice. He developed these methods. The idea is to find out which substances a tumor reacts to. In other words, how to treat it, how to kill it. Which substances help to damage these tumor cells?
And the special thing about the lab, I've been told, is that it uses methods from the complementary field as well as a range of chemotherapy from conventional medicine. And that's what I find so exciting. Now everyone has to listen, right?
You would think so, but oncology is very much characterized by guidelines, and they are not primarily wrong. They are correct in most cases, but not always. This is about cases where the guideline medicine doesn't work so well or doesn't work at all.
Are they cases where the tumor continues to grow under chemotherapy, for example?
I've already seen that, yes.
Then somehow it doesn't seem to work.
Yes, of course.
And in such cases, have you ever carried out an analysis on a patient like that?
Yes, exactly. Unfortunately, the test costs quite a lot. Here in Switzerland, it costs 2,800 francs. And then many patients say, it's too expensive for me. I understand that too.
Well, but anyone who's ever had chemo, I think if you ask them about it, it would have been worth 20,800 to you not to have to endure the procedure. I would almost say that.
Yes, of course I can't deduce that. If we do a test now, that he doesn't need chemo. So let's go back to the test. We measure all known chemo drugs. They are tested to see if they help. So we take blood, about 25 milliliters from the patient. There are tumor cells floating in the blood. They now go to the laboratory. There the tumor cells are filtered out and then multiplied. You can't do much with 100 cells. So these cells are multiplied over days so that we end up with a real mass of these tumor cells from this patient. And now these tests can be carried out on this new tissue, this tumor tissue. Around 300 substances are tested. That's incredible. This includes all known chemotherapy drugs, all known immunosuppressants, and antibodies. That's a lot too. And about 60 natural substances. They are all being tested. So afterwards, I will really have the opportunity to see which drugs or natural substances help with this tumor. And the objection from oncologists is always, yes, that's in the lab, you can't transfer that to humans. I don't understand it in detail. I also can't explain exactly how these tests are done, but I can see the result. When I use it afterwards, when I use these substances that have tested positive, people feel better and the tumors recede.
The argument that in laboratory, we have a lot of things that have simply been transferred from animals to humans. It's always a question of where it plays into whose hands. As a patient, do I have the option, assuming you get a diagnosis like this, you now have a certain amount of personal responsibility and say, I don't care now, I'll send it in, I'll just pay my almost $3,000 here. But afterwards, I would like to be treated exactly according to this scheme.
That is also my goal. The result, that's a lot of pages, comes back. And I give it to the patient and say, now go to the oncologist and show him this. If we can already see which immunotherapies are useful here, he doesn't have to prescribe another one. But the poor guy at the hospital is bound by his guidelines. I am free. That's a big difference. I am allowed to treat people individually. The oncologist in the hospital is not. The guidelines are the law. If he deviates from them, then he has to worry about his work. For me, that's not good medicine.
If I, as a patient, tolerate this chemo, I should actually call the pharmaceutical company and ask which clinic you supply. That I then find exactly the right contract partner.
That's possible. Any hospital can have these substances. These are common chemotherapeutic drugs. They all have them in-house anyway.
So, by guidelines, do you really mean that they're getting tighter and tighter?
They are very narrow. The guideline says very precisely. Let's take an example. Breast cancer, stage 1, hormone positive, HER2 negative. Now this therapy, let's say it still had cells in the lymph nodes. So now this chemotherapy, this is the #1 drug that we have to use. That's what the guidelines say. And if I see in this test that this drug is okay, but not the best, I can deviate. But I'm not an oncologist, so I can't offer chemotherapy. All I can really do is tell patients to talk to their oncologist and tell them that they would rather have this drug than the other one, which performs worse. These are difficult decisions for him, because he has to act in accordance with the guidelines.
Ultimately, however, I could well imagine that the key to a change in the whole system really is the patient. The one who no longer gives in to everything without questioning.
Of course, if a patient has this courage, this personality, to say to the oncologist, look, either you give me the drug that's here, that works, or I go to another hospital. Very few people dare to do that, but that would actually be the right thing to do. Why should I have a drug given to me when I have written proof that it is not the best?
What possible argument would a patient have? We're all familiar with this argument. It's all nonsense and humbug. Don't bother with it. We've seen it in all areas, even in nutrition. If you ask me, can I do anything with nutrition? No, you can't. These are really generalized phrases that are used again and again. What could the patient really rely on to say, okay, the laboratory has the qualifications, references, and experience to make you a bit more confident?
Yes, that's the case. So the doctor, Papa Zaterio, he's willing to talk to any oncologist. He's so brilliant at science, I sometimes don't understand exactly what he's explaining. It's not my world, this biochemistry. But why don't you do that, you oncologists? He's a colleague, a great scientist. Why don't you talk to each other?
I would still understand it if the tests only tested milk thistle or something, where you really say, but you really have all the chemos in this result, where you really say, we're testing your stuff. It's not as if we don't take it on board.
It's also not that we're rejecting it. If I see that immunotherapy is very effective, then I should do it. I'm not against conventional medicine, but I want to offer patients the best possible therapy and not the guideline.
I'm now thinking about what this does to the psyche. If I, as a patient, already have this pre-selection, then I have another reinforcing factor in the 100% certainty that I will get well. Other psychological issues also play a role here. As if I get something that I don't even know will work. That's the uncertainty. I'm going into chemo, and I'm always on the edge at first. So, we'll have to wait and see. And I think it's also very valuable psychologically when I can see in black and white that it's tailored to me. That has the maximum effect on me. It's simply another psychoneuroimmunological booster.
Yes, I think so too. So the patient, I don't have to say much when they see the test result. But what's exciting, Corina, is that out of 50 chemotherapies that are measured, maybe 3 or 4 are effective for a single tumor. And with immunotherapies, there are sometimes even fewer, only 2 or 3, although we have tested 50. So it's not that easy to find the right drug. When you then come to the natural substances, about 5 or 10 of these 60 are effective. So it's always the case that we have more effective substances in natural medicine than in chemistry. These are the results of experience, and I have to weigh things up there too. I have differences there too. Effective, yes, but not all the same. I can see all that in the results.
How do you work then? Well, for someone who is so holistic now, who says, I don't want chemo under any circumstances, are there also people who absolutely do? Would they then mix the alternative therapies, so to speak? So would that achieve a potentiation, or do you really focus on 1 or a maximum of 3?
These are questions of discussion and of the individual. You can certainly give several natural substances, and they potentiate each other. This is certainly possible, but not in every case. We can give these substances in capsule form. Most of them are available, but there are also some that can be given in infusion form. This is, of course, more effective because we have much higher concentrations. So vitamin C infusions are practically rejected by all oncologists. Vitamin C infusions are certainly extremely effective in half of all cases, according to the test. And they cost almost nothing.
I still find the doses exciting.
So we then give 15 grams. These are also differences. The oncologist from the laboratory says 5 grams is enough. The body can't process anymore. But there are others who give 50 grams. I'm not the scientist. I don't know. We take a middle course. Artesunate is almost always positive. It comes in infusion form. It's an infusion of the Artemisia plant. Curcuma, almost always effective. Then there are others that are partially effective, such as salvestrol or genistein. OPC, all these angio-stopping products, where the blood vessels grow or are stopped, these are also effective in many cases. Resveratrol is often effective. Everything is measured. I have a whole selection. Sometimes I can't use everything that would be useful because there are too many. And importantly, we can't just blow cancer away. It's not the case that if you take such a targeted approach, the cancer simply disappears. I want to make that clear. Cancer is still a very difficult disease with many factors. This is about optimizing a therapy, not about a guaranteed cure. Nobody can do that, but we have seen many improvements. I have a woman from Romania. We alternate between artisanate and curcuma infusions. In the latest MRI, everything was gone. She doesn't have chemo, just our infusions. These are the showcase cases. There are others where it doesn't work so well. Cancer is insidious.
Yes, I've said that before. I think the psyche is simply missing in integrative or complementary medicine. If we make this switch, all of this together, what is the disease trying to tell me? What am I living in my life? Nevertheless, I think it is one of the most important factors that is still being left out a bit. But when all the components come together in the future, you'll really have a therapist who works holistically and looks at what's actually behind it. It's not for nothing that we have the proverbial, what gets to your kidneys, what's run over your liver today. We have always associated emotions with organs, and I think it would be nice if the connection could be reestablished.
And also importantly, being diagnosed with cancer is a shock for everyone. It doesn't matter how old you are. The moment you hear it, you know, now I have to die. Practically everyone has this reaction. Of course, it's not like that.
Yes, it's a trauma now.
Yes, absolutely. It's a huge shock to start with. You have to explain to people that the types of cancer are so different. Some are more than 90% curable. You have to convey that as an encouragement. Others are more difficult, of course. But if the patient manages to behave positively and live with the disease and simply make the best of it, they have a much better chance than someone who breaks down and lets themselves go. If you can stabilize your psyche, you have a great advantage for the entire treatment period.
Yes, if you really manage to get out of this state of shock. Of course, this is also an issue where we can also see pictorially that when such diagnoses are announced, the entire system collapses. There would be more. That's my dream. I would like to set up an entire oncology center, but I need oncologists to join in. We have so many treatment options. We also know about hyperthermia. That's really fantastic, but hardly anyone offers it. In Switzerland, it's the hospital in Aarau that offers local hyperthermia. But I would like to have whole-body hyperthermia. Anyway, especially with metastasized cancer patients where they are in different places, you can get anywhere. We are currently working on a new method where you have a kind of bathtub that is equipped with ultrasound from all sides. Here, too, there are studies showing that these ultrasound waves shrink the tumors. Ozone therapy, who does that? I don't know. There is no literature, but I have the impression that you can achieve something with high doses. These are all things where we're doing a bit of work and a bit of research ourselves, but we are not a research center. We talk to the patients and see what they can cope with financially and what they like. Then we always decide together, often with the whole family, what we want to do. Ultimately, this is also experiential medicine. Only from this experience can you create new study profiles afterwards because you have recognized the effects. And the fact that the family is involved is a very important factor. Especially when you get a cancer diagnosis and you have a frightened environment and you decide on an individual path, then you may also have a few panicky people around you who also unsettle you or simply don't support you. Of course, this also causes huge stress in the whole system.
So I love it when cancer patients bring their partners or children with them. It takes all the stress out of the discussion at home afterwards. Did I understand correctly? Or when your partner suddenly says, "That's out of the question. What did he suggest there before?"
Or I Googled it and it's there.
It's really helpful. I really appreciate it when cancer patients come with someone, because then they both hear it. The patients themselves are sometimes so shocked at the beginning that they can't hear half of what I say. And it's really good when someone else listens. There is always hope. There is always hope for cancer patients. We are now also trying this low-dose naltrexone therapy. I know of therapists in the USA and Canada who are using it very successfully. Naltrexone is a drug that is used for opiate withdrawal, and a normal tablet has 50 milligrams. We start with 1/4 of a milligram and then maybe go up to 2 milligrams. Don't ask me how that works. I don't know, but it has a humor-inhibiting effect. Things like that. I'm not a researcher. I would have to get other interested researchers to take a closer look. But we never harm the patient. We do things that others have already done, where we hear or read somewhere about how it works and what others do. We give it a try, and if it proves successful, then we keep doing it. We also want to develop further and always hope to improve even more for cancer patients. This R.G.C.C test is really a great start to finding the right substances right from the start.
Yes, it gives hope. You are responsible for yourself. You already have solutions. So it's a really exciting field, and I hope that it really expands in the future.
Tumors seem to be increasing all the time. That's incredible. There are various reasons. The work never stops.
No, above all, it will be exciting to see how the new variants of cancer activity that we're now seeing react to this. I can't wait to see how your experiences turn out in the future.
I love the area. It is difficult, many fates. We've also had people die at 35 where we couldn't do anything. It was so explosive, this cancer development. We are also powerless, but that's not everyday life. Normally, we can help and keep people stable for years. I've really seen hundreds of cases.
That's great. Very nice. Thank you very much, Heinz. A really, really great, exciting topic. I'm pleased that there are laboratories like this, which are also able to help patients. It's also self-authorization. When I go there and say, this is my treatment plan, this is how I imagine it.
That's patient competence. That's the best.
Super. Thank you, and I hope to see you soon. Dear viewers, wonderful. Great lab. I hope you were able to take something away for yourself too, especially if you have people around you who you can empower with such self-empowerment. Is of course wonderful. I am always happy when you watch. Thank you very much. See you soon. Bye.